Hello everyone, welcome to sqadia.com. My name is Hammad Haider and today our topic is fractures. In this, we will have as usual the five sections. We'll be briefly discussing in the first section that what are the different types of fracture, what are the causative fractures, how it leads to fractures, and what are the pathological fractures. The second section we'll be discussing about how the fracture heals. There is two mechanisms, mainly the primary healing and then secondary healing, and we will be briefly discussing both the primary and secondary healing. The third section will be going through how the repair of fracture actually occurs, what is non-union, what is delayed union, and how to manage the non-union, which could be septic or aseptic. In the fourth section, we'll be briefly going through the how to diagnose a fracture. When a patient comes to you with a history of a trauma, then whether it is associated with musculoskeletal trauma, there may be associated with multiple limb fractures, and how to diagnose them, what are the different signs, how to go for look, feel and move, what are the three ways by which we can elicit certain tests so that we know that probably this patient is having an underlying fracture. And then the last, we will be briefly covering upon the impact of secondary injuries. Whenever we are dealing with the primary trauma, it's usually associated with polytrauma. A patient may be having a fractured femur, which may be very obvious, may be closed or open, but then still there may be other associated fractures as well. There could be associated spinal injuries as well. There could be associated pectoral girdle injuries. There are other visceral injuries associated as well. If the patient is having some kind of a pelvic trauma, there may be definitely some kind of a pelvic or acetabular fracture, but it's not only pelvic acetabular fracture, there's associated visceral injuries as well. So we need to look at the secondary injuries as well, so that the patient is dealt on a whole with some basis rather than only through a narrow approach that is focusing on what is apparently which is first visible on primary survey. Thank you very much. Keep watching sqadia.com.